Welcome to Mount Sinai Live. We stream smart healthcare information that's simple to understand so you can improve your health. I'm physical therapist Dr. Jimmy McKay, and I'll be your host. Today, we're learning what you need to know about brain tumors. To help us learn more, our Dr. Praveen Raju, an associate professor of neurology and pediatrics, and Dr. Oren Becher, chief of the Jack Martin Division of Pediatric Hematology Oncology at the Mount Sinai Kravis Children's Hospital's Children's Cancer Program. Gentlemen, welcome to Mount Sinai Live.
Thanks for having us.
Dr. Becher, let's start with you. When asked, what is a brain tumor, how do you respond?
That's a great question. Well, a brain tumor is a type of cancer, and it can arise in any age. Obviously, I take care of children. So in children, they are more commonly arising in the brain as a primary cancer. So they start there. It's an abnormal collection of cells that are not supposed to be dividing. And to accurately diagnose them, usually you need a biopsy. So you need to get a small sample that a neurosurgeon collects. And then we look under the microscope and do some extensive molecular testing to precisely categorize what type of brain cancer or tumor it is. These are also usually diagnosed initially, like in an emergency room setting, by either an MRI or a CAT scan. But the MRI or the CAT scan don't tell us definitively what type of brain cancer it is. That's why you need the biopsy as well.
Excellent. Thanks for clarifying that for us. Dr. Raju, we bring you in. Tell us about the up-and-coming pediatric brain tumor program at Mount Sinai and what makes it so unique.
Yeah, so we've always had the ability to treat children with brain tumors here at Mount Sinai. But over the last couple of years, a lot of things have actually been developing that have contributed to this new center being formed. One of the main ones is that Mount Sinai was one of the founding partners of this entity known as the New York Proton Center. It's one of the main new approaches to treating brain tumors with a type of radiation that's thought to be a little safer than older fashioned radiation schemes. And we're one of the three partners, and actually it's located right here in our backyard, 20 blocks away from Mount Sinai, which I feel like it's our brain tumor, it's our proton center, although it's shared by all of New York City. The thing that's happened, that's really shown a lot of excitement with regards to this pediatric brain tumor is the recruitment that's happened in this space. I joined Mount Sinai about 2 years ago. And Dr. Becher joined about 6 months ago. And what this brings to pediatric brain tumors here at Mount Sinai is a very unique expertise, not just in the clinical care of kids, but at the molecular and pathological understanding of the types of brain tumors that we both uniquely study in our research labs. But we hope that this will also be very advantageous to kids and their families, because sometimes, unfortunately, some therapies don't work as well as we'd like. But I think we're at the forefront to be able to identify why things don't work and hopefully advance this field even further. And I think very few centers, certainly in the New York City area and nationwide, have this capability. And I'm kind of excited that Oren and I are partnering to make this a reality here.
Excellent. I can tell you're excited, and that's great. Thanks for clarifying that. Dr. Becher, let's come back to you. Let's talk more about what conditions you treat at Mount Sinai Kravis Children's Hospital. Talk about some of those.
Sure. Yeah. So we can treat any type of brain or spinal cord tumor at Sinai. And what's happening in the last decade is that the tumors have become more molecularly subtyped. And so at Sinai, we do have the expertise to molecularly analyze the tumors and get at a precise diagnosis. This requires ability to correctly interpret the molecular analysis. And this results in an accurate diagnosis and then the suggestion of the appropriate therapy.
Dr. Becher, we'll stay with you. Primary goal of treatment. Let's talk about that. When asked, hey, what's the primary goal of treatment? How do you respond?
Well, of course, we always aim for a cure. That's our number one goal. There's different types of brain cancers. There's some in children that are highly curable, and there's some that are more challenging to cure. We have a fantastic team that requires a lot of different expertise. So we have our neurosurgeons, Dr. Gatan and Dr. Morgenstern, who are excellent neurosurgeons, to kind of start things off with a biopsy or surgical resections, depending on the particular tumor. Then we have Dr. Stas Lazarev. He's our radiation oncologist, and he's excellent at helping us decide if radiation is appropriate. And then we have 5 pediatric oncologists, including myself, as well as 5 nurse practitioners that together we work together to decide on the right chemotherapy regimen, whether it includes molecular targeted agents, and following some national protocols. So basically, we can treat any tumor, and we'll always do our best.
Excellent. Dr. Raju, we'll come back to you. This is a question for some of our audience that might be a physician partner. Why should a physician refer a patient to the Mount Sinai Kravis Children's Hospital for a brain tumor?
Yeah, well, I think there are many strengths here. We're one of the largest academic health centers, not just in New York, but in the United States. And when you're a very large center like this, you have a lot of expertise. And fortunately, in the peds brain tumor space, we have that. What I think uniquely makes us different than other centers is really our ability to interpret the molecular underpinnings of many of the types of brain tumors that we diagnose and treat. And not necessarily all centers have that capability, or at least if they do, typically it's more at a superficial level. Because we spend almost half of our time beyond just seeing patients, actually really getting our hands dirty in the lab, understanding these features. So I think, plus, I don't want to date ourselves, but Dr. Becher and I have decades of experience in this space, and I think that certainly is very advantageous for patients who are entering uncharted territory when they're diagnosed with something like this. So I think that experience will also be a reason that our center will be a boon to New York City.
Excellent. And Dr. Becker, we'll wrap with you. Let's talk about that how. How can a physician easily refer and be seen at Mount Sinai?
Oh, of course. Yeah, this is pretty easy in this day and age. So I think if you look on our website, mountsinai.org, you can easily find our division, Pediatric Hematology Oncology, and it has our clinic number and the physician profiles, so you can easily reach out to any of us. And if you can't get a response, feel free to email me directly. I'll make sure that we get you taken care of right away.
Excellent. Gentlemen, thanks so much for the time and for the insight and just scratching the surface really here on these questions about brain tumor. You can find us at Mount Sinai NYC on all major social platforms. This has been another Mount Sinai Live broadcast. We stream smart healthcare information that's simple to understand so you can improve your health. I'm your host, physical therapist, Dr. Jimmy McKay. Thanks for watching.